Good afternoon, class. My name is Sarah Spagnolo, and today we'll be covering the clinical condition Cadasil. The disease Cadasil is abbreviated for cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. It is an inherited form of cerebrovascular disease that occurs when the thickening of blood vessel walls blocks the flow of blood to the brain. The disease primarily affects small blood vessels in the white matter of the brain. A mutation in the Notch3 gene, which is located on chromosome 19, alters the muscular walls in these small arteries. There are currently over 150 different mutations causing the disorder that have been identified. Cadasil is characterized by migraine headaches and multiple strokes progressing to dementia. Other symptoms include cognitive deorientation, seizures, visual problems, and psychiatric problems such as severe depression and changes in behavior and personality. Individuals may also be at higher risk of heart attack. Symptoms and disease onset vary widely, with signs typically appearing in one's mid-30s. Some individuals may not show signs of the disease until later on in life. An interesting fact about Cadasil is that it is a hereditary familial disease. The transmission is autosomal dominant, which means that the person already affected by the disease has a 50% chance of passing the abnormal gene onto his or her children. Most individuals with Cadasil have a family history of the disorder. As we continue to move forward to talk about the etiology of Cadasil, it might be helpful to have some kind of visual to gain a better understanding of what's happening in the brain as this disease occurs. So, we have this oversized tennis ball here to use as our brain model to gain a better understanding of what's happening in the brain as this disease is taking place. The symptoms of the disease are mainly produced by the lesions occurring within the brain as the disease progresses. The lesions observed in the white matter of the brain correspond to the demyelination and to a loss of axons in the brain's neurons. This right here is the loss of axons in the brain's neurons. They start to lose. These lesions are associated with minor infarcts occurring mainly deep inside the brain as a result of an interruption in the blood flow to an area supplied by a small artery. These infarcts can leave a small cavity known as lacuna. We have that right here. Traces of tiny hemorrhages may also be visible in 1/3 of patients. The latest cerebral imaging studies show that it is mainly the accumulation of minor infarcts in the brain that explains the severity of the disease during Cadasil. The lesions in the white matter and the deep infarcts are due to a reduction in cerebral perfusion. A decrease in blood flow in the brain was observed within the white matter and sometimes in a more diffused manner within patients' brains. Permanent reduction in blood supply would appear to become more severe as the disease progresses, and this explains the gradual accumulation of cerebral lesions and the increasing acuteness of symptoms. The pathophysiology of Cadasil is caused by mutation in the Notch3 gene on chromosome 19. But research still has not come to a conclusion as to why it leads to an abnormality in the Notch3 receptor of the smooth muscle cell in the blood vessel, which could also potentially result in a buildup of protein, the appearance of granular osmophilic material, also known as GOM, and the degeneration of smooth muscle cells in the vessel wall. What researchers do know is that the important part played in the Notch3 gene and the development of small arteries has clearly been demonstrated. Cadasil affects males and females in equal numbers. This neurological disorder is found worldwide and affects all races. This disease affects approximately 2 to 5 out of 100,000 people. What research suggests is that the disorder often goes undiagnosed or misdiagnosed, making it difficult to determine the true frequency of Cadasil in the general population. The signs typically appearing in one's mid-30s, and by age 65, most people with Cadasil have cognitive problems and dementia. Symptoms of the following disorders can be similar to those of Cadasil. Sporadic cerebral small vessel disease, commonly known as SVD, multiple sclerosis, and a variety of rare genetic disorders may have symptoms compared to those found in Cadasil. These disorders include cerebral autosomal recessive arteriopathy with subcortical infarcts and leukoencephalopathy. The abbreviation for this is Cadasil. Mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. The abbreviation for this is MALIS. Fabry disease and a variety of leukodystrophies, rare progressive metabolic disorders that affect the brain, spinal cord, and often the peripheral nerves. Risk factors for Cadasil include smoking, hypertension, hyperlipidemia, diabetes, blood clotting disorders, and obstructive sleep apnea, which should all be treated aggressively. Cadasil is suspected based on symptoms, family history, and brain MRI lesions compatible with the disease. Although an MRI can identify characteristic changes in the brains of individuals with Cadasil, such changes are not unique to Cadasil and can occur with other disorders. As such, the Cadasil diagnosis can only be confirmed by DNA testing of blood samples for characteristic mutations in the NASH3 gene, or by identifying GOM inclusions on a skin biopsy. In regards to related precautions, no specific preventative treatment for the disease is known to date in Cadasil patients. Individuals are given supportive care, migraine headaches may be treated by various drugs, and a daily aspirin may reduce stroke and heart attack risk. Drug therapy for depression also may be given. Lastly, physiotherapy is essential and must be widely prescribed when motor signs and difficulties with walking and balance are present, especially after one has a stroke. Speech therapy is prescribed to improve communication and language abilities when necessary. Here's a chart that I found that demonstrates what the brain looks like in various Cadasil stages. This first stage here is the mild stage, which typically starts in one's mid-30s. In this stage, one will experience migraine with ARIA. The next stage is the moderate stage. This is where we start to see mood disorders and lacunar strokes. If you take a closer look at this image, you can see that here, the brain is more darker in the moderate stage compared to the mild stage. This is due to blood vessels thickening, resulting in the blockage of blood flow to the brain. This occurs about ages between 40 to 60. Lastly, we have the severe stage, which is typical for ages 65 and over. Here, the patient will start experiencing cognitive problems and vascular dementia. I found this diagram to be an effective way to show how Cadasil progressively gets worse over time. Studies say that when you actively learn, it helps you memorize the content better. Since we just got done talking about how a decline of memory and other mental abilities is a significant symptom of Cadasil, let's do an activity that can help us jog ours. We are going to play Twister, but there's a little twist, in today's game. Each dot is going to have a different fact that we covered today about Cadasil. Once you land on your dot, you will read your fact out loud to better comprehend the information. Is everybody ready?
Yeah.
Okay, Katie, you go first.
Okay.
Left hand on yellow.
Cadasil is characterized by migraine headaches and multiple strokes progressing to dementia.
Very good. Aaron. Right foot on red.
Signs typically start to show in one's mid-30s.
Yes, it does. Katie, right hand on red.
There is currently no specific treatment, but aspirin and other medications may help.
Very good. Erin. Right hand on green.
Cadasil affects approximately 2 to 5 out of 100,000 people.
Nicely done. Katie. Left hand on green.
Mean. Cadasil is a hereditary familial disease.
Nicely done. Erin. Left foot on blue.
No. Some risk factors include smoking, hypertension, diabetes, and obstructive sleep apnea.
Yes, it does. Katie. Right hand yellow.
The Notch3 gene is located on chromosome 19.
Awesome. Last one, Erin. Left hand on blue.
The last one is at age 65, one will start experiencing cognitive problems and vascular dementia.
Very good. Thank you all for playing, and thank you all for your time.